Welcome to this conversation that I'm happy to host today with Dr. Hank Balfour. Hank has been a member here at Westminster for more than 20 years and has been on the University of Minnesota Medical School faculty for almost 50 years, 48 years. And there he started the Virology Institute and ran it for 40 years. He's a virologist and a vaccinologist and is a clinical physician. Not a research physician, but a clinical physician, so he actually deals with what disease does to an individual and how to treat it. He's also been a pediatrician through his time as a medical doctor, and he's still serving at the University of Minnesota medical faculty. So we're grateful, Hank, for your participation here. You've been on our Westminster COVID response team, and we've worked from late spring until August when we produced our plan for the church. And one might ask, as we start this conversation, we're 7 months into COVID, why a video now?
Well, Tim, thank you first for the nice introduction. And video now is unfortunately more appropriate than ever because the situation is a little worse than it's been.
And are you speaking of Minnesota as a state or the whole nation? Or
I think the whole nation, but particularly Minnesota and other parts of the upper Midwest have been experiencing the largest number of new confirmed cases per week or per day or per month now than we have seen since the start of this pandemic hit us in March.
So is this what we were warned about might happen in the fall, what we call the second wave or a surge?
Yes, I think that with the coming of fall and winter, we have less opportunity to be outside. And it's important to say that close contact with infected people is the way this virus is spread. And we have less opportunity to stay apart when we're forced indoors by the weather. Another point to be made is with cold weather, people tend to get their respiratory tract kind of dried out, and it becomes a little more susceptible to infection in that way. And finally, one of the things that I think is important to emphasize to those watching this is that we shouldn't become pandemic fatigued and really forget to put on our masks, forget to distance. Social distancing is so important. One of the things that I took away from the most recent interviews on TV was a nurse in New York who was right at the center of the very, very ill patients. She was asked, would you rather have a vaccine or a mask? She said, I'd rather have a mask.
That really dramatizes the importance of taking precautions. And honestly, I think all of us are fatigued with the pandemic. I mean, who isn't tired of this isolation and who wouldn't like to have a little more social contact? And I remember just a few days ago, a front page story in the Star Tribune describing that very thing, that people are weary and letting down their guard, so to speak. And I know here at Westminster, honestly, it's very hard for those of us who are serving the church not to be with our congregation. And I know our congregation wants to be with the pastors and teachers and with one another. But we're going to have to bear with this for a while. What would you say are the most important things to tell Westminster's members about responding now to this crisis?
I think that we need to be aware that social distancing, wearing a mask, avoiding crowds, avoiding very close indoor contacts is necessary to protect us. The workforce thought the most important thing when we decided that it would be better to close the building essentially was human health and the safety of individuals. And it is depressing not to be able to have person-to-person contact. What I can say is that all epidemics, viral, bacterial, what have you, come to an end. It may not be 1 year, it might be 2 years, but this will end. And I suspect that we will have an effective vaccine fairly soon. So what I say to folks is please keep in mind that your best vaccine right now is wearing a mask and staying at least 6 feet from people that are not in your immediate family constellation.
That's very helpful, Hank. And I know you and I took our masks off and made sure we were 8 feet apart for this conversation, and they will go right back on when we're done. Westminster has adopted a phased-in plan, which you helped us develop, Hank, and that phasing plan goes to 6 phases, and we're in phase 2, which means we're not able to gather here. We're able simply to do broadcasts from the church for worship and education, and we're able to do some small group gatherings outside, and our staff members are helping that happen. But we do need to respect this virus and treat it with the caution that Dr. Balfour and others are urging us to follow. So, Westminster, let's hang in there for a while longer. We'll get through this, wear our masks, we'll stay apart from one another, we'll be connected in so many ways. The technology that we're using is really helpful. We have covenanted still to be the church, even though we are apart. Dr. Balfour, thank you very much for this conversation and for your wisdom along the way.
You're very welcome. And to everybody, please stay safe, keep well.
Thank you.